Gynecological Society. I'm also a honorary lecturer at the University of Nairobi Medical School.
All right.
Yeah, I also have a private practice at Mirazi Healthcare, and I also practice at AR clinics in Nairobi.
Okay.
Yes.
What's an obstetrician?
So an obstetrician and gynecologist is a specialist doctor who deals with women health issues, pregnancy, and common gynecological issues.
All right.
Yes.
So for today we want to talk about menstrual health, okay? And kuna watu hawajui, basically, in a layman's language, how would you explain what menstrual health is? And
Okay, so normally I'll start with defining what menstruation is. Menstruation is a normal cycle in a woman, which entails bleeding and ovulation, which allows a woman to have the normal fertility functions. Yes.
Okay, you say it's normal for a woman to experience this. Is it a must? And is there a problem if a woman does not experience this?
Yes, it's a problem if a woman does not experience menstruation, because when you are not menstruating, it means you're not ovulating normally. It means your cycle, your menstrual cycle is not functioning normally. And when your menstrual cycle is not functioning normally, it makes it difficult to conceive, to have to get pregnant. Yes.
Okay. So what on the street now, let me speak now like a layman.
Yes.
Like what I hear on the streets and what is out there.
Yes.
People say during this time, women are very emotional. They don't like some people or things around them.
Yeah.
Is this a reality, or is this just a chauvinistic kind of thinking?
It's actually true. Some women experience hormonal changes during their body during this time of their menstrual cycle. Remember, the menstrual cycle is regulated by hormones in your body, and these hormones tend to affect your behavior. So you experience what you call PMS, which is premenstrual syndrome, which is the effect of the hormones on your body. So you tend to get mood swings. Some people refuse to go to work. Some people get into unnecessary arguments and all that. Other symptoms in the body associated with that, maybe you can get headaches and menstrual cramps along with that, and sleep disturbances.
All right.
Yes.
Well, then someone somewhere suggested there should be like an off, say for whatever reason, like for the period, specifically say maybe 3 days, 4 days, 1 week. You get an off day from work.
Well, I saw somewhere that some countries have implemented that. Sometimes it can be very severe. PMS can be very severe. During menstruation, some women experience extreme pain that they're unable to go on with their normal functions at work or at school, so they end up staying in bed. So in such circumstances, then yeah, maybe. But others, they don't experience such severe symptoms and they're able to function normally.
All right.
Yeah.
So in an ideal setting, how should a woman prepare for this?
So as a woman, you know how your body behaves during this time. So have some painkillers beforehand. Ensure hygiene. Ensure you have enough sanitary pads during this period. And of course, take enough rest, drink, rehydrate well. Basically just the usual menstrual hygiene.
Okay.
Yeah.
So you were told it happens after a month.
Yeah.
So let's say 28 days.
Yes.
Now, is it specifically 28 days, or can it even prolong to say 40 days?
Yeah.
Or what is the normal range?
So on average, the normal range is 28 to 35 days, but it can go up to 21 days. That's on the lesser side of things, and it can go beyond. I mean, 35 days is the average, but if it's more than 35 days, then that's abnormal. If it's 21 days and below, then that's abnormal. That means your periods are irregular, and that requires medical attention.
True. So you say people that maybe go through this, say, twice a month, that's an abnormality.
Yes, that's an abnormality.
And you need to seek medical attention.
Yes.
So how would you then advise anyone to prepare, say, hygienically?
Okay.
Yes.
So hygienically, ensure like you shower regularly, at least twice a day. Ensure you have enough sanitary pads, whatever works for you. If it's sanitary pads, if it's tampons, if it's the menstrual cup, whatever works for you. Ensure you have regular change of these sanitary products. So like on average, you need to change your pad at least 4 to 6 hours. That can vary depending on the flow of your periods. If your flow is very heavy, it can be less than that.
Okay.
Yes.
Can anyone now use 2 methods at the same time? You've mentioned tampons, you've mentioned pads. Can one use both methods at the same time?
Yes, you can. It depends on how heavy your flow is. Sometimes some tampons tend to leak, especially if you have very heavy menses. So if you have very heavy menses, I'd advise one to maybe have a panty liner to prevent that leakage.
Okay.
Yeah.
You've already said to maybe you change after 4 to 6 hours.
Yes.
Indeed. And also that depends with the availability of the tampons. And say, what if, because there are girls that don't access these things, what else can they do? What else can they use? Okay,
so there are other options one can use. There's the menstrual cup, which is reusable.
Right.
You insert it into the vagina and it holds a menstrual period for a period of 12 hours. So you need to change it on average 12 hours. We at the COG Society also recommend menstrual panties, which are special panties that absorb menstrual blood for a period of time. Yes. Okay.
You mentioned the COG Society. What's the COG Society?
So the COG Society is the Kenya Obstetrical and Gynecological Society. It consists of members who are consultant obstetrician and gynecologists and also doctors in training in the same. And it's a body that's involved in policy making in the country, guidelines in the country. Yes.
All right. So then what are the risks of using, say, unrecommended things? Because you hear crazy stories, maybe others using leaves.
Yes.
Just crazy things.
Yeah.
So what are the risks of that?
So unfortunately, not everyone can afford these sanitary products. And we've had cases of such cases going on in certain communities. So that's not recommended because first, those products are not, those substances are not designed to absorb menstrual blood. So it doesn't serve the right function of preventing leakage of this blood. It can also predispose you to infections. Yes. So it's not recommended.
All right.
Yeah.
Is there maybe a campaign to make these things available to girls that you think are vulnerable? Because why I ask this is I'm sure in your campaigns you've had this.
Yes.
You had this talk where girls get exposed to, say, early pregnancies because maybe they went to look for money to get these things. So is there a campaign like that to make sure these pads are available to the unfortunate girls?
Yes, there are campaigns that have been done by Beyond Zero, by the Ministry of Health, to make these products more available. And other NGOs have been involved in these campaigns to donate sanitary pads to the less fortunate.
All right.
Yes.
So, pia nyinyi wenye mko home ningependa kujua maswali zenyu and any opinion you have towards hii situation. Na nimewaambia leo tunaongelea menstrual hygiene na we mark the day on the 20th of May. Swali yako natuma kwenye 22422 ama #daybreaks, ndio? Unajiachilia hapo na mimi na daktari hapa. Mimi nauliza yeye anajibu, sio ati tutajibu, yeye ndo atajibu. sana ni atajibu. So as we wait for people at home also to chip in during this cleaning. Yes?
Are we on off?
No, we are on. We are good. Like they can talk.
Okay.
I will get the feedback.
Okay.
When they send it.
All right. Thanks.
So you said about cleaning.
Yes.
And taking care of yourself. So is there a particular way, say, of cleaning? Because actually, you see, if for eyes, you're told if you're cleaning your eye, you move from this side to this side.
Yeah.
Okay. So what about for ladies also?
Yeah.
Is there specific things they need to do?
Yeah, so at least ensure that you shower regularly, at least twice a day, or more than that, depending on the flow of your menses. It's also advised that you, if you're cleaning, you normally, even when you're not menstruating, it's advised that you clean from front to back, always front to back.
Okay.
Yeah.
Sawa sawa. See, then let's get feedback from home, and maybe you get to answer since you're here.
Yeah, sure.
Ndio? Okay. Ibra, maswali yangu nijibu hawa watu. Niulize tujibiwe na daktari. Okay. The first question, what causes extreme pain in girls during this period?
Okay, so there are many causes of, so extreme pain is during menses is defined as dysmenorrhea. Dysmenorrhea is what people call cramps during their menstrual period. So there are different causes of dysmenorrhea or pain during your menses. You can have things like fibroids, which are very common in the African community, especially in our setup here in Kenya. We have very many women with fibroids. We have a condition called endometriosis, which is abnormal. You know, the uterus has an inner lining cells, and these cells can be abnormally deposited in different parts of the body. So when this happens, those parts of the body also bleed.
Okay.
Yeah, and you can get extreme pain during your periods. And if they're in other parts of the reproductive organs, it can cause extreme pain. Another cause is adenomyosis, which is abnormal cells deposited in the middle lining of the uterus that can cause severe pain.
Okay.
Yes, it's very common as well.
You said fibroids are a common thing. Why,
yes.
why here?
So fibroids are more inclined to the African community, the black community.
Okay.
It's just a genetic thing. They're not so common in the white population.
Okay.
Yes.
Sawa sawa. Thank you. Let's go to the next question.
Yes.
Hi doc, kindly advise in case where after giving birth, someone takes over 6 months without menstrual cycle.
Yeah, so you can have disappearance of your periods. It can be normal sometimes, like when you've just delivered,
yes,
or during pregnancy. That's absolutely normal. But if you've not just delivered and you're not pregnant and your periods disappear for months, 6 months, a year, that's abnormal. And there's certain conditions that can cause that. You can have polycystic ovarian syndrome, which causes hormonal imbalances in your body, and that causes your periods to be completely irregular. Another cause would be like when your ovaries fail prematurely. Normally your ovaries function, and they function to ovulate and ensure that they also produce hormones to ensure that you get pregnant. But in some instances they fail prematurely, like if at the age of 40 and below. If they fail prematurely, then that's abnormal, and that can cause your periods to completely disappear. So you tend to go to like an premature menopause in premature ovarian failure, and that's not normal. Other causes would be when you're using contraceptives. Certain contraceptives cause hormonal imbalance in your body, and that can cause you to not have normal menstruation.
All right.
Yes.
Thank you. Why is it that a woman experiences menstrual flow but can't conceive?
So if you're having such conditions, it's usually due to ovulation problems. Like I'd mentioned before, your ovary takes part in ovulation and production of certain hormones that balance your body to ensure you ovulate normally and you conceive normally. So if your ovaries are not functioning normally, then that can cause you not to ovulate, and that can cause you not to conceive. So it's possible in some instances.
Okay.
Yes.
Another one is asking, what causes irritation or UTIs?
Sorry, let's go back to the other question. You could also be having, if you're menstruating and you're having trouble conceiving, there could be structural problems in your uterus that are preventing normal pregnancy and implantation of the pregnancy. Like, for example, if you have tumors like uterine fibroids inside the uterus, and that prevents normal implantation, and that can cause infertility.
All right.
Yes.
Is it treatable?
Yes, it's treatable.
Okay.
Yes.
Sawa sawa. Another one is asking, what causes irritation or UTIs after periods, and how can they prevent that from happening?
So infections before and after your periods is very common because your uterus has its own cycle that enables it to function normally, and it also has its own cells that have their own functions within it. So during your menses, you're shedding, you're bleeding, and you're bleeding off these cells in the inner lining. So when you're bleeding off these cells, you're losing them, and these cells have a function to maintain the normal environment, like for example the normal pH. Normal pH is acidic. So if these cells fail to maintain, or if because you're losing them and that environment is not maintained, it can predispose you to infections. Also, the cells also act like a local immune system, so it prevents you from having infection. So that's why women who, some women complain of infection immediately before or after their menses, because the cells are lost, are being shed, and these are the cells that prevent infection by ensuring that there's a normal acidic balance and just by providing normal immunity. So that's very common.
Is it preventable?
Yes, it's preventable. You can take substances that maintain that acidic pH, substances known as lactobacilli, and that they can be found in certain medications or even certain foods. Yeah, they just maintain the normal acidic pH balance, which is what is required to prevent infections.
Thank you.
Yes.
Another one is asking, is there any problem if the periods do not come when one is using family planning?
That's it happens a lot, and that's absolutely normal. It's just associated with the family planning. Once you withhold the family planning, your system usually goes back to normal. Yes. Like
immediately, or you wait for a period of time?
Sometimes it takes a few months. Yeah, because the drugs are being loaded into your body, the hormones. So it takes a while for your body to break them down, or for the concentration to go down.
So there's no cause for alarm?
No, that's normal with family planning.
All right. Thank you. Another one is asking, my daughter has a lot of pain when in periods, fever, no appetite, and vomiting. Is this normal?
Yes, it's normal during your periods because there's hormonal imbalances. The hormones produced during that time affect your general well-being, so you tend to get sick. It's part of the premenstrual period syndrome. Yes, so you get headaches, some people get nausea, some people get diarrhea, some people get vomiting. Yes, so it can be that severe.
And how do you handle these symptoms?
So usually you just take medication, supportive medication. So if you have a headache, you can take painkillers, which also will help with the menstrual cramps. If you have vomiting, you can use vomiting medication. If you know you get very sick, a few days before, you can ensure you have this medication, at least 3 days before. Yeah, like painkillers 3 days before. It helps.
Before it comes?
Yes.
All right. Well, this one is a funny one. I don't know if it's a funny one, but let me ask. It says, hi doc, when specifically during menstrual cycle, one is likely to conceive a baby boy?
So there's been myths about that. I mean, you can't really tell. You can't really control what you conceive. Yeah.
For real?
It's usually myths. Yes.
You can't control?
Not 100%.
Oh, okay.
Yes.
Then now you bring us to another topic, which is myths and misconceptions. Before we go back to the questions from home.
Yes.
What are the common misconceptions you get as a doc about the entire menstrual cycle process?
Misconceptions.
Or myths, just like the one you've just had now, that there's a specific way, specific things to eat if you want a boy or a girl.
Issues about diet. So some people are advised not to have certain things like sugar, caffeine, because it worsens your periods. Yes.
And is this true?
It's actually true.
Okay.
Yes.
Sugar?
Yeah, sugar actually makes menstrual cramps worse.
Allah?
Yeah.
It's a new one.
Yeah, so it's advised that you just eat healthy, drink a lot of water during that time, a lot of fruits and vegetables, ensure you're well hydrated.
Okay. Thank you. So hapo kwa kijana madota please umesikia. Yeah, let's take another one. It says, I normally receive my periods after every 2 weeks. Is it normal?
Yeah, that's not normal. There could be maybe issue on contraception, family planning, because that can cause, sometimes you can have bleeding that's in between your periods. From an ectopic kidney? No,
Vaginosis.
Oh, vaginosis. Okay, bacterial vaginosis.
Yes.
Okay, so ovarian cysts are also very common. They can, sometimes they grow and reduce naturally back. I mean, they reduce in size, or they can grow excessively. So when they grow big to more than 6 centimeters and they're causing severe pain and discomfort, then that needs surgical attention, meaning they need to be removed if they're causing stressful symptoms on the patient. With uterine fibroids, also the same. Sometimes they grow big and they can cause a lot of pressure symptoms like constipation or difficulty in passing urine, and also excessive bleeding. Heavy bleeding that continues on and on, even up to 2-3 weeks, depending on their location. So when they cause such discomfort, uncomfortable symptoms to the patient, then they need to be surgically removed. Okay. Yeah. Bacterial vaginosis is an infection. Actually, thank you for bringing that up, because it's infection caused by change in the vaginal pH, which also is predisposed by your menses, because the local immunity at that time goes down. So you can get bacterial vaginosis from time to time. It's just because of the shift in the normal vaginal environment. Okay. Yeah, which can be caused by menstruation or other factors. Yeah, like exposure to certain things like soaps, harmful substances that just alter the vaginal pH.
All right.
Yeah.
So what would you advise her to do?
So there's certain substances that she can take to maintain that pH, which is called lactobacilli. They are found in certain medications, also certain foods. Like natural yogurt, it's advisable to take natural yogurt to just maintain that pH and prevent infections. And there are also washes, which I'd recommend. Another myth is people say that washes are not safe. There are actually special washes that women use that maintain this vaginal pH, and they have the lactobacilli substances that prevent those infections. Yes.
Another normal soap?
No, normal soap is not advisable, because normal soap alters the pH and it has harmful agents that destroy the vaginal environment. So that's not advisable. But the special vaginal washes actually do prevent these infections, because they have those substances that maintain that pH and keep the normal environment healthy.
Does water temperature matter? Say hot water, cold water?
No, it doesn't matter.
It doesn't matter?
Yeah.
All right. Let's take another one. Hi. My daughter is 13 and hajapata periods, and all her mates wamepata. Is it normal?
Sometimes you can have a late onset of periods. It can go even up to 16 years and above. Yeah.
What is the normal age that one should start expecting this?
The average age is about 11 to 16 years. Like, that's the widest range. Yeah.
So what causes that delay?
It's just hormonal imbalances in your body.
Okay.
Yes.
So this parent needs just to be okay?
Yeah, she can wait. They usually, sometimes there's late onset. So okay. That happens.
Sawa sawa. Kwa hivyo hakuna pressure mzazi, tulia tu. Wako itakam tu. Aya. Why is someone experiencing cramps yet she does not receive the periods?
So is this someone who has already had their menses before? If yes, sometimes it depends on the hormonal balance in your body. So if you're on contraception, some contraceptives cause you not to bleed. So you can have maybe just spotting and the symptoms of periods like cramps, but you don't actually have the period itself. Conditions like polycystic ovarian syndrome, you can have absence of your menses, but some people experience the symptoms of the menses like cramping, but you're not actually bleeding. Yeah.
And in that situation, you have any cause for alarm?
Yeah, that's abnormal. If you're not bleeding at all and you're not on any form of contraception, that's abnormal if you're not receiving your menses. But there's some instances you can have cramps when you're not bleeding at all. Like, for example, if your menses are about to start, a few days before, you experience cramps before the bleeding, and then the bleeding comes after.
Okay. And what of the people that maybe get the bleeding, say, one day and they disappear?
Yeah, that's scanty menstruation. That's also abnormal.
Okay.
Yeah.
Sawa. Another one. 11 days later, periods are not pregnant. What might be happening to my body, please? She says it's 11 days later, she's still experiencing it, and she's not pregnant.
She's still experiencing bleeding?
Yes.
So bleeding for more than 7 days. So on average, you should bleed for 5 to 7. At least 5 days is on average. It can go up to 7 days. But beyond 7 days of bleeding, that's abnormal. That's prolonged menses, and that's abnormal. And it could be caused by conditions like fibroids, hormonal imbalance. Yeah.
All right. Let's take another one. Hi, doc. I always have severe pain during menstruation, and I have tried to conceive for around 4 years, which I have not managed. How can you help me, please?
Yeah, so as we had said earlier, severe pain during menstruation is not normal, and she needs to be checked for conditions like uterine fibroids, which is very common, endometriosis and adenomyosis, which we talked about earlier. So that's not normal. So, and those conditions can actually cause infertility. So she needs to be checked for that.
Okay. Let's take one last one, then we get back to this.
Yeah.
What if the blood comes out when it's very dark and you're not experiencing low abdominal pains and you have been using family planning? What's the problem, doc?
So normal menstrual blood is actually bright red. Sometimes it can be dark when it's initially starting, like brown, darkish, or towards the end of the period, like maybe the last day and thereafter, it turns to dark brown. If you're using contraception, some contraceptives give you scanty periods or spotting, and the color may not be like normal menses because contraception affects the way you menstruate. So yeah, that's normal with contraceptives.
Okay.
Yeah.
So no cause for alarm. Hapana stuka. Doc, I want to take you back kidogo to when we were talking about the entire menstrual hygiene.
Yeah.
And the entire conversation around it. You see, like for us, while growing up, this conversation was kept for girls alone.
Yes.
What is your take on this? While growing up, say in school, they would isolate girls and go teach them, and they'd come back with pads, hide them. At least they've been told not to show boys these things. So you used to wonder, what is this? So what is your take in all this?
So I think the boy child should also be involved in these processes because eventually you get married and you're going to live with a woman. So you need to understand the processes that involve menstruation, menstrual hygiene, general care, and because that goes around infertility, fertility issues, and so the boy child needs to be involved. And also mental supportive care, because sometimes these hormones, the hormonal issues associated with premenstrual syndrome can also take a toll on you, and also the pain and other symptoms. So it needs also support, mental support, psychological support. Yes.
Say maybe the actually teachers who are watching that, or just anyone that is an adult that maybe would want to have this conversation with teenagers, say in school, how would you advise them to handle this situation and this conversation? Because this thing has been treated as something to be ashamed of. Yeah. You know? So how do we take away the shame, and how do we have this conversation?
So there's education around reproductive health education going on in schools right now, and this is a very important topic, and it should be available to both male and female students. Yes.
How then do you think men would be of help during this time? What do you think they can do?
Just psychosocial support. Ensure that they have everything, they provide everything available for her, sanitary towels, just general care. Yeah. Psychological support, psychosocial support.
What does it entail?
So just being there for her emotionally, you know, if she needs something, give her, and also ensure that, because you need to be understanding during this time, because some women experience severe pain, they can't do anything.
Yes.
So ensure she gets proper rest, and yeah.
Okay. Now then you've brought in a dicey topic now when you say ensure she gets what she wants.
Yes.
There are women that are in now, not young girls now, women that are in serious relationships and married, and during this period, there are men that maybe would want, how do I put it, would want to be intimate with their partner. How would you advise?
So yeah, that's also part of the understanding part. During this, during menstruation, women are very uncomfortable. They're in severe pain, and mentally it's just a struggle, stressed and all. So I'd advise men to be more understanding during this period. And the body is not designed for intimacy during that time. It can be very uncomfortable. So I'd say that men should be understanding at this point. Yeah.
Okay.
And because the body is not designed to be intimate at that time, I'd advise maybe women to take a break. But some people actually do it and they're fine with it. But I'd advise that, yeah,
just to wait.
Take a break, yes.
All right. Well, as I wait for, say, 2 more or 3 questions from home, let me ask. You said there is moods and everything during this period. What about cravings?
Yes, cravings are there. Some people crave for sugar.
Which you said you stay away from.
Yeah.
Okay.
Junk food, you know, fries here and there, KFC, yeah, those things.
And in your in your bid to offer this support, yes, what if they're craving for things that you've told me to stay away from?
Yeah.
How do you handle that?
Control. Yeah, I think you just have to control yourself. It's individual based. Yeah, you just control what you eat and what works for you.
Okay. About the misconceptions, now that we've been talking about, we've said, first of all, we've established that there is no system to identify if there is a boy or girl. Is there any other misconception that is out there that people believe is a truth? Because that one I've just learned today. I've always thought that it's if you eat lemons. Have you heard of those stories?
Maybe we can hear from the viewers. But there are a lot of misconceptions out there.
Out there, yes?
Yeah, it's when you talk to people, that's when you hear these things.
True.
Yeah.
Sawa sawa. Na pia kama wewe ni mdem na kuna beliefs tu umejuanga kutoka kwa mtoi, hebu jiachilie before tumalize show. Ujibiwe leo, uanze kuishi maisha ukijua form ni gani, sawa? Okay, let's check one from Twitter. This one is @Muziza. May I inquire, please, will one get pregnant when they get intimate during the period of menstruation?
No, you won't. Because the body is designed to have a system that works for it. So you menstruate your first 5 to 7 days of your cycle, and then from like the middle of the cycle, from about the 10th to 14th day, that's like your safe days. That's when you can conceive, but not during your periods.
Kabisa, it's not possible?
It's not possible.
For real?
Yes.
You've not heard such stories? You've not heard such instances that people say, you know, it happened when I was on my piece? It's
not possible, because when you're on your periods, your body is shedding blood and cells. So that environment cannot accommodate pregnancy or implantation at that point. Yeah, it's a system it's like a cycle that works by itself. Yeah.
Then you've brought another angle of your safe days.
Yeah.
How then would you count? How do you know when you're safe, when you're not safe?
So an average, let's put it like, let's use an average cycle of 28 days, right?
Okay.
So mid-cycle, let's start from day 1.
Okay.
So day 1 to day 5 is when you're menstruating.
Okay.
At that point, you're shedding cells, you can't conceive. And then you continue counting day 6, day 7, up to day 14. So day 14 is the middle of the cycle. And day 14 is the time when you're fertile, or let's put it like unsafe days, and that is when you can conceive. So in the middle of your cycle is when you can conceive at that point.
Okay.
Yeah.
Yeah. Say, and now let's go to also menopause.
Yeah.
Because it's involved here. Someone is asking, in the case of menopause,
yeah,
does it mean now you will no longer get your menses, or you will still be getting them?
So menopause is complete cessation of your menses. Average age is 51, but it goes from 51 to 55 years of age. Yeah, when your menses completely disappear, because your ovarian function, your ovaries, the function declines with age. So as you get older, the function of the ovaries diminishes, and when you get to that age, the function has completely stopped. Okay. So you can't menstruate. You can't have the normal menstrual functions. Yeah.
Does anything replace that?
Unfortunately not, but there's certain medication. No, you cannot replace you cannot restore your periods.
Not restoring.
Yeah.
Like your body adopting to the change.
Gradually it does.
If you used to cramping and all this, when this disappears, is there any other change that happens with your body?
Yes, so you get like some women get hot flashes, some women get mood swings sometimes, some women get bone pain, because these hormones are declining in your body as you age, and these hormones also have other functions in your body like bone health. Some women get vaginal dryness, and these hormones also have a role in maintaining moisture in your vagina. Yes.
Okay. Can this happen earlier?
It can happen earlier. Remember, we talked about premature ovarian failure, which is like, in layman terms, I'd call it like early menopause. Your body goes into early menopause. Typically happens at the age of 40, below the age 40 and below. Yeah. Yes.
It can happen.
It can happen.
And when it happens, you've said that cannot be reversed. Say if it happened at the age of 40 or 35. Yeah,
that unfortunately cannot be reversed, but there's some medications that you're given that like hormonal replacement therapy that maintain like your body functions.
Okay.
Yeah.
Then say you've been experiencing this. You say you're 35.
Yeah.
And you're no longer experiencing this. How then do you now recognize this is it, this is menopause?
So when you have complete cessation of your menses for a year or more. Yes.
All right. So, let's take one more from Twitter. At Gillian, what are the recommended painkillers to be used during menstruation?
So recommended painkillers, so menstruation is associated, what causes the pain is certain substances produced in your body that cause that severe pain. So you need medications that counter the effect of those substances that are produced in your body. So what we normally recommend as COGS is using medications like diclofenac, mefenamic acid. Those medications actually reduce, they work by reducing the bleeding and reducing the severe pain at that point because of the substances that are produced in your body that cause pain. So they counter the effect of those substances. Other medications you can use are Buscopan, which helps in it relaxes, it reduces the spasms, or the, how do I put it in layman terms, the pain. Yeah, the pain associated with that effect. Yes.
Well, I've heard of stories that people say when you cuddle, when you say, does that help during the pain?
That's part of psychosocial support.
Okay.
Of course, when you have that care around you, your body also senses it, and it has a relaxing effect.
All right.
Yeah.
Another one from Twitter at Kevin Namayo 4. What could be the problem with someone having a stinking menstrual flow?
So that's infection. Maybe that person had infection from before that was not well treated.
Okay.
So yeah, that can be abnormal. Yeah.
So if there's any sort of smell,
so, very bad smell, but period blood generally has a smell. Yeah, blood generally has a smell. So there's that normal blood smell, but there's foul smell. Foul smell is there's some underlying infection that was probably not well treated prior.
Okay. Another one from Twitter, Stephen March 3. Is it normal for change in color of discharge during ovulation?
So normal discharge does not have a smell.
Okay.
And it's usually white. Now, if the discharge changes color and develops a foul smell, then that's abnormal. That's infection, and that needs to be checked. So yellow, green discharge, that's not normal. Yes.
Okay. Sasa, let's come back now as we wind up to the 28th. Is there anything planned for that day?
So yes, 28th is Menstrual Health Day, Menstrual Awareness Day. We'll also be coming up and talking about menstrual issues, menstrual health. Yes.
Okay. Is there, say, a safe space for girls to air their issues, to talk about things that maybe they are not comfortable to talk with their parents? How do they reach you? Say, maybe you, if anyone wanted to reach out now, they've watched you, the issues they want, because, you know, there are things you've said here, people need medical attention.
Yes.
And they are watching from home.
Yes.
And now they're thinking, the doc has said now I need medical attention.
Yes.
How would you advise them to get this medical attention? So
they can come to Mirazi Healthcare. They can book an appointment there. I'm also available at AR Clinics, the South Sea branch on Mondays, and George Williamson House on Tuesdays, and ICA, AR ICA in the CBD on Wednesdays, so they can reach me there. And is this help? And also, sorry to interrupt you, also the Causes Society also has events about these, like menstrual health awareness events, yes. Okay. In government institutions, government hospitals now and clinics, if I walked, say, with my daughter or my girlfriend or wife, are we likely to get this help? Yes. At affordable? Because, you see, the biggest challenge to this entire situation, from my perspective, is the affordability of things. Say, from the affordability of pads, affordability of tampons, and the healthcare itself. Yes. In government institutions, because you mentioned about the Kenyatta National Hospital. Yeah. Is it readily available and affordable? Yes, it's affordable. We have clinics at Kenyatta which take care of these menstrual issues, conditions associated with it. So it's there. It's available. Sawa sawa. We have clinics, yes. Are you on social media? Says maybe someone would want to slide on your DMs. Maybe you've said something and they think only you can understand. Yes. They want to slide on the DMs and talk about it. Yeah. How do they reach you? So on Instagram, I'm Dr. Angie Anzeze. Yes. Facebook? Facebook, Angela Anzeze. Or Mdora Anz. Yeah? But I prefer Instagram. For such matters. Yes. Okay. Yes. Instagram once again is? Dr. Angie Anzeze. All right. Yes. Sawa sawa. Anything you'd want to add or say hi to people at home? Thank you so much for this opportunity to create certain common health issues affecting women. Yes. I like to support women in health matters, and this is a very good opportunity. So thank you. Kabisa. Yes. Karibu sana, any day, anytime. Sisi tuko hapa kwa ajili yenu, si ndio? And asante. Keep doing what you're doing. Thank you. Sindio? Yes. Asante sana. Wale mko home,
I hope mmejibamba. I hope you've learned a thing or two. Kama una feel vitu daktari amesema unahitaji kwenda hospitali kuangaliwa, usianze kuhesitate tena ati wacha nione itapita. Kama amesema unafaa kwenda OC abahatishi, enda usiuangaliwe, si ndio? Na kama amekwambia usipanic. Kama huyo mzazi wa mtoto wa 13 years umeambiwa usipanic, tulia. Sawa? Asanteni sana for tuning in. Tupatane kesho tukipika, au sio? Follow me on Facebook, Shataboy, Instagram, Shata_boy, Twitter, Shata Tikitaka, and also follow Willis Raburu kila pahali, Facebook, Instagram, Twitter, hadi TikTok @Willis Raburu. Si ndio? Tupatane kesho. More life.